You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I'm extremely excited today to be bringing to you Dr. Suzanne Miyamoto. Dr. Miyamoto is the CEO of the American Academy of Nursing with 2 decades of policy advocacy and nonprofit experience. Dr. Miyamoto provides visionary and strategic leadership to help the organization achieve its vision of healthy lives for all people. Dr. Miyamoto is highly regarded for her expertise in public policy and developing strong partnerships to advance sound policy solutions that are evidence-based, patient-centered, and community-oriented. Throughout her career, she has worked with a wide network of stakeholders across the healthcare industry, from insurers to consumer organizations. She is a successful leader in the development of advocacy-based coalition reaching Congress and the administration. Prior to her position at the Academy, Dr. Miyamoto served as the American Association of Colleges of Nursing's Chief Policy Officer. In her 12 years of service at AACN, Dr. Miyamoto supported the membership as a policy analyst, advocate, and strategist at the federal level. She simultaneously led the Nursing Community Coalition, the largest national nursing coalition focused on elevating the voice of the profession in health policy discussions. Dr. Miyamoto is a member of the National Academy of Medicine's Leadership Consortium, the National Quality Forum's Board of Directors, the Association of American Medical Colleges Research and Action Institute External Advisory Committee, the National Minority Quality Forum's Advisory Board, and the Sibley Memorial Hospital Quality and Safety Committee. Currently, Dr. Miyamoto holds a faculty appointment at Georgetown University School of Nursing. Welcome to the show, Dr. Miyamoto.
Thank you so much for the opportunity to join you today.
Thank you. And what do you do on your spare time? Because there isn't a whole lot after the academy and all those other committees. So like, you have no more time.
It is a busy schedule, but I'm proud to represent my profession in a variety of sectors and with different parties. But in my spare time, I have 2 not so little ones anymore, 11 and 8, and I get to run around with them at their activities. I think as a mom.
That works. So we'll get started with my first, well, I guess now it's my second question, is how did you get started in the world of nursing?
It's a great question, something to reflect on, and we all probably have a different story of how we were drawn to the nursing profession. Interestingly enough, when I was graduating from high school, I really wanted to work with people, serve my community, and I had applied to the University of Michigan to their School of Language Science and Arts, their LSA program, because I wanted to get a degree in psychology and then become a social worker. And I wanted to go to the U of M master's program in social work, and that was my trajectory. Then my father and my sweet mother, both of them chimed in and said, you know, it would be really good if you had a career in which you could walk out and just get a job. And they, really encouraged. I have 2 brothers and a sister, and they encourage us, you think about a career that has longevity. And not that my first choice wasn't there. I always thought that I would start nursing and then maybe think through another avenue. But I had a couple of experiences. My 2 of my aunts actually are registered nurses. And so I had an opportunity to shadow them. And then I went to the School of Nursing at University of Michigan to see if this might be a path for me. And I remember at the time going into kind of the admissions office, talking about being a transfer student and coming into the program in my second year, and all of the courses that I would need to take, and I still had that love of psychology. And I said, I'm going to continue to pursue my degree in psychology, but also nursing. And I said, that's going to be very difficult with the rigorous schedule that is nursing. And it certainly was, but something that I held on to because it was part of my passion. I think understanding how people think and communicate and interact in this world helps us as clinicians be better providers. So I wanted that strong background in kind of how individuals connect in this world. So I think having both degrees really did help me. Nursing was an incredible path, and I'm so glad that I took it. There were a few times, I'm sure through all of us, where I was like, okay, this might not be for me. And I thought about those 6 a.m. clinicals where you had to get up and all of your other, college friends were just sleeping away. But I saw the impact that it made. And I'm sure we all can tell stories about those experiences that really landed us, fully integrated with the profession and the holistic care that we provide. I remember one of my first experiences where a patient had passed. And I went with the nurse, who was my, preceptor at the time. And we were doing care after death. And I remember coming out of the room, and the son of the individual that had passed said to me, "You were the nurse that was meant to be here this day." I wasn't a nurse. I was this nursing student, but it would just really reinforce the personal connection and sometimes just the presence and how you enter a room, how you give yourself to that community. So that was one experience that I absolutely felt this is a part of who I want to be able to bring forward, to be able to help people feel that what they're going through is not necessarily in a shared experience, but in a way that someone's seeing what they're experiencing, and it's not just another, patient in a room. The other experience I had, which kind of solidified my nursing career, was I had the opportunity, my clinical in maternity and women's health. I have to tell you, the first baby that I saw delivered through C-section, it was this large 10-pound baby. And woo, I mean, it was something to behold. And I just loved working with mothers and their newborns. And so that is kind of the path that I took afterwards. I still have my love for psychology, but that was where I wanted to land after.
Wow, amazing. Both very like touching stories from the perspective that nursing really is a birth all the way to death profession, and we have the privilege of being present for both. And I think that that's a lot to say. As you're sharing this story, I'm getting a little choked up because I'm at the same time I'm remembering all the patients that I've had. Not so many birthing stories. I only have maybe a couple of those. But definitely I've had my share of individuals that have passed just because of age or I was in emergency medicine for a long time, and unfortunate events have led to their deaths. But it's really like when you said that one family member that said you were the nurse that was meant to be here. That's very touching. That's very insightful or deep. I don't know how to. It's very almost feels spiritual. That we're selected for those moments.
And it's a moment too that you can't forget. I
Yeah,
remember being in the hall and, a light touch, and I didn't know what to say, and I just gave a light touch back.
yeah,
And it was a really powerful moment. And I think, we can get so caught up in all of the challenges that we face, even in our own lives, that it's really hard to bring our best selves to any work that we do.
yeah,
But the people that we serve, they need our best selves, even when they can't give it their own.
yeah. Yeah, very true, very true. I hope nobody ever. I know some people we talk about things like burnout or
Mhm.
Sometimes I call it burn down because of things that are done to us, but I'm hoping even if we sort of lose touch of the about from those moments once in a while, I hope everybody comes back to those moments because those are the moments that are really meaningful. So thank you for sharing those.
Mhm.
Um, uh, so I take it you went the route of maternal child health or women's health
Mhm.
services. How was your experience going into that, and how did you find your next step? Because you didn't stay bedside. So how
Mhm.
what were the things that led you to those next steps?
No, it's a great question. And so my first job out of nursing school was at Henry Ford Hospital in Detroit. And I worked in postpartum. It was an absolute wonderful experience. The nurses there were remarkable. And I remember being with the patients and still using the translator phones and trying to communicate where I really saw some of the challenges with health equity and not being able to provide the services in the way that we want to. Thinking about, younger patients that are having children of their own and how to support them. And at that time, I had met Dr. B. Kalish, and I'm not sure if the listeners are familiar with Dr. Kalish. Dr. Kalish and Dr. Phil Kalish had done a lot of work in health policy and nurses in politics, the image of the nurse, and I met her after I had graduated or before I graduated, and I had walked into her office thinking I was just going to make an appointment. And essentially, she walked out of her office and said to me, so what are you doing here? And I said, well, I'm here to make an appointment with you, Dr. Kalish. And she said, well, just come in right now. And I was not prepared to talk with her. I just thought I was making this appointment to talk to her. I still remember I had on like a yellow sundress. I'm like, I am not ready to meet with Professor Kalish. But I went into her office and she was very clear. And I joke to this day that I just listened to Dr. Kalish and off went my nursing career. She said, you're going to take the NCLEX, you're going to take the GRE, and you're going to start in my master's program in the fall. And so that's what I did. I took the GRE, I took the NCLEX, I started my first job, and then that fall, I started in the master's program in nursing business and health systems. And I will share that it was a different experience. And one of the things that I reflect on is, again, I was not, as many people know in the nursing profession, you're usually not starting your master's degree right after you finish your undergraduate program. And Dr. Kalish and the faculty at Michigan, Dean Hinshaw, who was the Dean Ada Sue Hinshaw, who was my dean at the time, said, Suzanne, you don't have to do what everyone did. And, one of the things that I experienced in those clinical rotations, which eventually led to health policy, was I saw that there were larger systemic issues that needed solutions. And it was through my experiences working at Henry Ford and even working later in my master's program. I worked on a research project with Dr. Stein around women with anorexia and bulimia. So bringing in my psychology background, and you could even see the challenges within the mental health system. So it was during that one of the great things about the graduate program was I was still relatively a student, but I had these incredible classmates and they were incredibly supportive. They never said you're too young to be in this program. We supported each other. I would help them with Excel and Word, and they would help me with understanding some of the financials that they would be doing. And it was a really collaborative experience that I don't think everyone always gets. And
Mm,
so one of the things that I've been very passionate about is throughout my career is giving back to individuals within the profession that want to blaze a slightly different path, that want to try something non-traditional. But at this time, everything can be traditional in nursing. It doesn't have to be, it can be designed in the way that you appreciate it. And I think that's what really launched my interest, those experiences, working with women with anorexia and bulimia, and working at Henry Ford, to be able to say, okay, now how can we look at this from a larger perspective? So I had done kind of like an internship at the Michigan Nurses Association, and oh goodness, I loved going up to the state capitol and talking to members of Congress and their staff, at the state capitol about nursing and just what the profession does and how we needed more funding for scholarships and loan repayment. And I wanted to see what it was like at the federal level. So I I just finished my master's program, and I talked to Dr. Kalish, and I said, I really want to go out to DC. And Dr. Rosemary Romy, who was a professor at the time at the school, said, I've got this friend at the School of Public Health that knows members in Congress. So I actually ended up working as an intern in my member of Congress's office. And on the third day, because I was a nurse, I had a master's degree. My father was a small business owner. They said, okay, the congressman is going to give a speech on the House floor about health plans for small businesses. Write it. And I was like, oh, goodness. So I worked with the press secretary and the health legislative aide. And a few hours later, the words that I helped write, the congressman was reading on the House floor.
Mm.
I still to this day have the congressional record that has those words, because it was just such a powerful experience that my background in healthcare, my background with my family and small business, all voices are needed to impact policy and the richness that it comes. So Professor Kalish intervened again and said, Suzanne, you got into the doctoral program, so you have to come back. So I did not stay in Washington, D.C. I did go back to do my PhD. After my 2 years of coursework, I packed up all of my possessions and drove out to D.C. hoping to find a job. Well, that's kind of the story of how I got there.
That's amazing. And there's so much work being done right now with various, for example, the American Nurse Association, from the state level organizations, from the different nursing organization like the Black Nurse Association, the Hispanic Nurse Association. There's so much of that work that's being done. But how are we, in your opinion, are we doing enough to provide those experiences for our students, right? Because like I see pockets of this stuff happening, but I think because there's so many, there's like, every time I hear it, it's like more nurses, was like 5 million nurses at this point, that we have within the US. How do we engage that workforce really? Because I always say nursing is political, whether you like to think of it as political or not, nursing is political. How do we engage the workforce so they are better informed and can do that kind of advocacy? Because I think we'd be so much, I mean, again, we're the largest healthcare, body profession in the US, but I don't think we have the traction that we could, right?
Well, and I would agree with that statement. And what I will share, so I've been teaching health policy to nursing students for quite some time. I taught at Michigan. I taught a class at Hopkins, and as in my bio, I've been teaching at Georgetown for quite a while. And I have to tell you, the difference between, let's say, nursing students in the last 4 years versus the nursing students I would teach maybe, 5 or 6, 7, 8 years ago, even 10 years ago. Their interest in policy is significantly more than it ever was. I used to get student feedback on my evaluations that says, I can't believe Georgetown makes me take this course. It's like, I need to learn clinical, not policy. And so,
Right.
but now I see whether, because as you mentioned, it's as we think about the politics and policy, they are intertwined. You can't separate it. It's always going to be there. I think what happened during the pandemic, I think what has happened over the last few elections, nursing students are paying more attention. It's impacting them. It's impacting their practice. They want to understand how to make that shift. And so that's encouraging to me. I really am excited to see that, at least in my institution where I teach. But what I would also say is that we are the largest health profession, yet our resources are not as robust. And when I say that, I think one of the challenges that we have is we have, almost 100 nursing organizations at this point in time. Not all of them have registered lobbyists. Not all of them have PACs. There's only 4 organizations with a political action committee at the
Mm,
federal level. So when you think about who can, support candidates' campaigns that are working on behalf of the issues that are important to the profession, it's not as robust as some of our other health professions, insurers, or you know, uh, pharmaceutical industries for that matter.
right.
And that does become a challenge. And what it all stems back to is membership. And if there are 5 million nurses, where is that membership? How do we teach our students that if you can't be a voice because you are doing 8 million things, your national association that represents the things that you are passionate about, or even if students wanted to join organizations that are disease specific, or that they can partner because it's an issue they're passionate about, those membership dues really do help. The opportunity to work with the Nursing Community Coalition was, I always say, was one of the best experiences of my life. Um, at the time when I started, it was, you know, being run by a outside law firm that was doing the work pro bono. And my dissertation had been on the Title VIII nursing workforce development programs. And so I had this great opportunity to say, they said, okay, well, we can't do Title VIII reauthorization, which Congress was taking a look at, and coordinate that effort. And so I said, in working with a senator's office, I said, okay, I'll take this on. And I remember Polly Bednash, who was my CEO at the time, was like, are you sure you want to do this? I said, absolutely, we can do this, Polly. So we convened 41 national nursing organizations to kind of come together on strategies and specific language to amend those programs, which then launched into our work for the ACA.
Mm,
And we pulled together a statement from the nursing community that was essentially a blueprint of everything we wanted in the ACA as a community. And we used that document for all of these organizations that were lobbying on the Hill to say, this is what the profession wants in healthcare reform. And that was one of the proudest experiences I've ever had, to be able to work and negotiate and collaborate with all of these lobbyists and CEOs who were trying to, move their issue forward. But we recognized that if we don't do it together, it is going to be one voice, one voice, one voice.
right.
And sometimes that is a necessity because we have divergent issues that our members work on. But for big systemic health reform changes like the ACA, it was imperative. And so I still think fondly on that experience, because we knew as a profession of organizations how critical that was.
Yeah, I agree. Now, as far as you mentioned membership. I think ANA. I think the last time I looked, it was something like 400,000, maybe 500,000 members, which is a very small percentage of the actual number of nurses that we have. Uh, how is there a way that you think that we can engage, or is there, I always say, I'm going to throw my 2 cents into this. Someone like, if it was just part of the state licensing, like, even if it was like 25 bucks a person, I think the ANA would make a lot more funding and you'd have that membership. But I don't know how the rules for that work. It's probably there's something probably not kosher about that. But how do we actually, other than going to each individual nurse from a profession, do we address those membership issues for those for those organizations that do represent us?
Mhm. It's such a challenge,
Yeah,
because first of all, you want engaged members. You
yeah,
want members that want to be a part of the organization. And I think in the scope of the American Nurses Association, one of the biggest issues when you talk to, nurses working in our hospital settings and acute care settings, it is the burnout, it is the staffing, and there are other channels for them.
yeah,
The National Nurses United, I know, is gaining quite a lot of traction around their staffing positions. And I think the question becomes, when we look at nursing, what is the crux of who we are as a profession?
right.
And one of the reasons why I am just so honored and really love my opportunity to be the CEO of the Academy is because the Academy works on healthcare issues.
Mm,
And to that end, they bring the nursing lens. And I think messaging really continues to be a struggle within the profession.
right.
I've spoken with members of Congress, with their staff. My entire dissertation was on interviewing congressional staff. And they will say to me, Suzanne, when nursing comes up, it's, I want this, we need this, give me this. When medicine comes up, it's, our patients need this,
Mm,
and this is how we can provide it. And it's solution oriented and patient oriented, which to us, the nursing profession, that is the crux and core of who we are.
right.
And yet our messaging sounds like we need something, we want something.
Yeah,
And even to this day, you look at the funding that goes to our profession versus other professions, it is a drop in the bucket.
right.
And I do think that there needs to be a shift for the way that we communicate to our representatives, communicate to the public around the biggest challenges that are facing us, because they can't see the nursing lens. They can see the patient lens. They can see the patient experiences, whether it be their family member, whether it be that individual themselves. They've all had an experience some way, shape, or form. So helping them to understand those challenges is really important. So messaging is one piece. I think the other piece is that, you know, organizations, nonprofits in general, membership organizations have been waxing and waning over time. And it's not unique to nursing. When we see interest moving forward, even within our medical colleagues, we know that, there's not as robust interest in some medical organizations as there is others. And so I think that the question goes back to is, if I were a professor in any university, and how I teach my students is, I think in every single course, every single class, even if it is just the professor saying it themselves, talk about what organizations they belong to, why it's meaningful to them.
Mm,
Because there's this political science theory, it's Goldstein's theory of political action. And essentially it says, teach someone and show someone how, right? If we can just talk about it or show people, you're not going to get 5 million nurses to go go to Capitol Hill. I mean, it's not going to happen.
right.
But if we can, get a larger perspective, and, I tell my students anytime, if you're interested, send me an email, let's talk. Because my path has been a different one, and there are a lot of students that can choose that path. So I think messaging and positive reinforcement of the importance of our
Yeah,
profession being a voice for health.
yeah, I agree. Now you mentioned you got this just triggered something in my brain. You mentioned you got your master's in business and health system.
Mhm.
Um, and I see some like nursing is becoming for me very clinical focused, right? Almost like the medicine model. Um, are we as a profession losing out when we start specifying like what pathways students should be going towards and getting rid of some of the things that may not necessarily be, I'm air quoting, in the NCLEX or in the national board certifications for like master's prepared individuals. Are we losing some opportunities when we start cutting out degree like nursing administration? Don't see that many of them around anymore. Nursing education, we don't see them around that many around anymore. Other master's degree programs that are that are not the clinical focus necessarily are starting to wean off. What are we missing? I know we're missing something when we got to get rid of these programs, but in your opinion, having from a political perspective or not policy perspective, what are we missing out when we start shifting that way?
You know, it's something to certainly for the profession to grapple with. And I will say, I can't begin to express how much I learned from the School of Public Policy at the
Mm,
University of Michigan. The richness of what those professors had experienced, for example, Richard Hall, who sat on my dissertation committee in the School of Public Policy. He had worked in then Majority Leader Senator Daschle's office, and that richness that we learn from other professions and other disciplines, I think enriches the core of nursing. And when I think about, if I were to go back again and do something different, I never regretted my experiences within nursing, both in the master's and the doctoral degree. But I cannot express how enriching taking courses from other disciplines was towards my understanding of what I would do later.
mm,
And I think, when we talk about, administration programs, you're going to learn a lot from our interprofessional colleagues. So doing
yeah,
a master's in hospital administration or doing an MBA, that richness only adds to nurses' ability to do something different.
yeah.
And one thing that I wonder about is, as you know, I worked for many years at AACN. I worry about our science
Mm,
and the number of students going into PhD programs. The latest data from AACN, that's declining. We are a
yeah,
science-based discipline. We still need our body of evidence to be building our profession.
yeah,
And that is a real concern to me of students choosing, other courses or other directions. Um, because who's going to do that research for us in the future? So
yeah,
all that to say is that I think that there's ways to enrich our profession through learning through other disciplines and the contributions of nurses by learning through other disciplines. But I also know that our discipline needs to advance our own science. And given that science-based discipline, how we look at it from a holistic patient-centered view, it is really powerful. So for any listeners out there that are thinking about a PhD, go for it. I think it is a way for us to continue to advance the contributions we make in so many different ways.
yeah. You bring up a great point, and actually, I just had this discussion with a colleague of mine who was trying to choose between the two. And one of the things that I will ask you is, is nursing doing enough to promote the PhD programs from a support perspective? Because it's costly, it takes more time, and unfortunately, we have I don't want, well, it's my show. I can say it. We have faculty that are gatekeeping, right? And I saw it being in academia. I saw it because they feel like they are the people that are standing between you and that degree, and you will do it. And it's not, and it's not flexible enough. We have individuals that think PhD programs, you have to quit your job and be on site 5 days a week making less, like half of what where you were making before to make, especially if you're looking at LA area, for example, there's no way you can have a family, pay your mortgage, and be in a PhD program, even if it's a paid PhD program, that's going to pay you like maybe, 75, 80,000. And like, I'm not going to be able to pay my bills,
Mhm.
right? So how much barriers are we causing within our own profession, um, that is keeping people out of those PhD programs?
It is a challenge, and I think that's one of the when you think about nursing, we have every single pathway possible imagining, right? We
True.
have RN to BSN, we have uh, ladder programs, we have master's degrees, DNPs, PhDs,
There's a
we
lot of
have
ways. Yes.
and to some extent that does cause the complication of what's the pathways that are most the easiest to move through, or the options to move through. Our colleagues in other disciplines don't have this large option based of education.
Right.
And so I think from my perspective, when I was in my doctoral program, I did have support. I was also, not married and didn't have children. So I do think, for me, it was feasible. I completely understand that that's not feasible in every other way. But what I will say are two things. First, when I was in my program, I had to piece together different funding sources. Um, the School of Education, they took like 7 students and paid everything, right?
Right.
And so are we just expanding the programs to take students even though we can't fully support them? Should we think about a model that allows us to fully support, get them through faster, and out into the world? That's obviously one strategy. I think the other piece, when we consider that, is how do we talk about the program so it doesn't feel like things are being gate kept, if you will.
Yeah.
But I'll go back to the core of where I started in my career is we need more federal funding.
Yep.
I can't tell you how many times I would go to Capitol Hill and talk about the faculty shortage and how we needed more doctorally prepared nurses and how we needed to dedicate fund to this. I worked on even the higher education reauthorization in 2008 because in that we're looking again at what about Pell Grants? What about, Stafford? So there's always these other avenues that I think we have to be mindful of. I think there's a richness to both doctoral degrees, both the DNP and the PhD, and I'm seeing come through even within the academy more DNP PhDs because the top clinical and top science, just like MDs and MD PhDs.
Right.
And I think it's just maybe it's a different lens of how we invest.
Mm.
And maybe it's not pockets, but full funding
Yes.
to be able to move them through faster.
That'd be great. That'd be fantastic. It would have helped me, but but I'm grateful. HRSA picked up 3 years of my loan, so I'm grateful for that. So I appreciate it. So I want to be cognizant of your time, and I definitely want to talk about the Academy because so many people, unfortunately, don't know what the Academy is about. So I want to touch base on that and have you share what the Academy is about, what kind of work are we doing, and I'm sure there's people out there listening, like, how do I join? Air quoting join. So.
Absolutely. Well, as I mentioned before, the Academy is a really unique organization, and I'm so just proud to be a part of it. I became a member in 2015, and through that experience, was able to learn a little bit about the organization. I still remember you said join. So the Academy is what we call both an honorific society and a policy organization. So as an honorific society, individuals are inducted into our organization. There are 2 fellows that support you in that career and that journey to become a fellow of the American Academy of Nursing. Most people recognize it as the FAAN behind individuals' names. The Academy was founded over 50 years ago now, 51 years ago, through the American Nurses Association. So really bringing together the voices of the profession to make an impact on health and how it is moved forward. One of the opportunities that came over time with the Academy as it moved its base to Washington, D.C., was that it became its own 501c3. So the Academy is an independent 501c3, and the ANA is our sole corporate member. And through that, we have an opportunity to work on a lot of healthcare issues from a policy lens. We are not a advocacy or lobbying organization per se. We don't have a political action committee. So some of the main issues that we have been working on have focused in on gender affirming care. There has been a lot of challenges at the state level. So we've been partnering with our colleagues at the American Academy of Pediatrics and joining amicus briefs to fight those cases going on at the state level. Another big issue that the Academy has put a lot of effort in has been around maternal health, working with Congresswoman Underwood on the Momnibus and Black maternal health, as well as safe reproductive rights. So that has been a big issue for us as well. A couple of years ago, we released our statement on gun safety. On violence prevention and gun safety, really focusing in on how are we going to support our communities. So all of these issues really are at a level of health, and how are we bringing that nursing lens to those discussions. And one of the things that I think is really important about the fellowship is the individuals that are inducted into the Academy, just like yourself, have experience and expertise in so many areas. No one fellow is alike. But the fellow membership, when you think about, the writ large within the United States and then globally, the number of nurses, because we do have members from fellows from around the world, there's a little over 3,000 fellows within the organization. So this really is a place where we're trying to bring together thought leaders to advance the profession's voice in healthcare discussions. And most critically, the organization looks on advancing health policy from a health equity lens. So I've really been proud of the work that our expert panels have done, as well as our staff, to make sure when we're submitting Congress to the administration or to weigh in on legislation, we are giving that lens of health equity.
Great, thank you. Now, from a perspective, just because when you see a lot of the fellows from the Academy, you tend to see people who have been in the profession for many years, and I was happy to see some mid-career fellows that have been inducted over the past several years. So I was excited to see that. Now, from your perspective, what is the future outlook for how we want to engage the profession through fellowship?
Absolutely. So the board of directors right now is working on our next strategic plan, and kind of envisioning our next 3 to 5 years, but also our next 50 years. And as we look at that, one of the questions that we've been asking ourselves is, nursing's expertise is, as we talked about earlier, is so vast. The issues that we're talking about at the federal level, at the national level, is AI, is focused in that virtual nursing is a huge topic. AI is a huge topic. The health perspectives around ethics in AI is quite significant. We still grapple with challenges around cost, quality, access. And I think nursing has the answers because of the areas where they've practiced, or the mountains that, if you will, that they've moved. The uniqueness of what nurses are doing, I think of a fellow, Paul Leone, who's out in California, who has been and created one of the largest nonprofits to help the homeless population in California. And, a fellow of the academy. It's
Yeah.
not necessarily what we all think of a dean and a faculty member and moving forward.
Right.
And so the academy is really looking at that richness. And so for anyone thinking about the opportunity or considering fellowship, one of the biggest things that I will say is that in life, we need mentors. And oftentimes finding the right mentor, the right champion is really important. And working with your mentors, and particularly if your mentors are fellows of the academy, to be able to say, how can I be ready? What is it that we can do together? How could you champion me in different experiences? I was incredibly fortunate to have individuals that said, Suzanne, come along with me to this. Suzanne, here, Suzanne Feetham, for example, she said, I will help you get a policy, experience at NIH. We will get you where you need to be.
Mm.
And I encourage everyone who is a fellow, help someone get to where they need to be, because they're going to be the next generation of leaders. And I do see a trend now. Our average age is still in the 60s, in the later half of the 60s. But we're seeing individuals. We have the youngest fellow that came in was 29 years old.
Yeah.
So this is not an organization that defines success by age per se. It is defined success by the impact that an individual has been able to make in a community, and it's the community, it's the nation, and it is a global impact. And I am often inspired by what I see my colleagues doing.
Oh, thank you. I appreciate that. We are almost at time. I want to make sure I give you time to speak about anything else that pops into your brains or you'd like to share.
Well, thank you. I will say this has been fun to reflect on what got me to where I am today. But one of the things that I want to reiterate, because it is a really challenging time for the nursing profession, when I speak to my students at Georgetown and hear their experiences, it's everything from how staffing is addressed. It is workplace violence that we see, all of these the weight of what individuals within the profession carry, in addition to their family lives and their personal lives. But I go back to how you described it earlier. Reflect on those moments of bright and light. We all have them, during our nursing careers, and to give those bright lights to the next generation, because we don't want them to see the profession that we experienced in a negative light, because there's so much beauty in giving back to individuals. So I close to say, please mentor, please support individuals that want to contribute in a way that we are as ourselves did when we were younger, those rose-colored glasses, if you will. Keep them on as long as you can, because there is a lot to contribute to this great profession.
Great. Thank you so much. And I really appreciate it. I know you're a busy individual, so thank you. Thank you for sharing this time with us. We have been listening to Dr. Suzanne Miyamoto from the American Academy of Nursing. Looking forward to catching up with everybody on the next episode, and I appreciate your time. Thank you. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.